Okay, now the recording has started, so I can recap and start again. Good morning, everyone. Good afternoon, good evening, depending on where you're joining in from. Welcome to the official launch and induction of members and maiden webinar of the Public Health Interest Group Africa, PHIGA. We're very excited to have everyone here. My name is Yoande Ogunkwade, and I'm going to be one of the hosts of this event. I'm one of the executive at PHIGA at the Human Resource team, and I'll be hosting this event. Um, my co-host will be Jemba. Jemba is on. Jemba, would you like to introduce yourself, please?
Yeah, sure. Thank you, Yowande. My name is Jemba Michael Senkole. I'm from Uganda, and I'm going to be the co-host. I serve as the Secretary General at the Public Health Interest Group Africa, and yeah, I'm excited for this. Thank you.
Thank you. Thank you so much, Jemba. So before we go forward, I'm just going to play some housekeeping. I like that people are joining in, and I'm so grateful that almost everyone has their mic on mute. So please, like for us to just go on with that throughout this call to keep our mics on mute to help us to prevent any form of disturbance. Also, there's a chat box down there. I'm sure I don't know if everyone knows how to, but it's just down the chat box. Please, when you have to go into the chat box, all you just need to do is type. And this is Google Meet. We have an activities session. Just write down of your screen. And on the activity session, we have a Q&A part where you can actually put in your questions, and it also gives you the room to put in your questions anonymously if you wish to. Just put in questions that may be related to PHIGA. And if we want you to put your questions directly to the chat box, we would emphasize on that. Okay, so those are like the basic housekeeping rules we have now. And like I've introduced myself and Jemba has introduced himself, we would want everyone on this call to do a little form of introduction. And to do that, I just want people to post in the chat box. This is different from the question and answer section. In the chat box, I would like you to put in where you're joining in from, what your name is, what country you're joining from, what what organization are you affiliated to. If you're a student, you can just put what school you attend or what course, just to show to show how diversified we are as members of PHIGA, and how just to show how how we are representing Africa as a whole. So please, just few minutes. I'd like people to put on the chat box. I can see some people already writing. Welcome, Ada from Nigeria. Um, Welcome, Ayomide from Nigeria. We're so glad to have you here. Please. Oh, okay. And this is from Narian from South Africa. You're welcome. So please just put on the chat box just for us to know where people are joining in from, and as a form of introduction, because we might not have the capacity for everyone to introduce themselves. It's a very, very large group. Okay, so as I'm sure all of you know, and as you have seen from the flyer, the theme of this maiden webinar is the role of African youth in achieving the new public health role. And PHIGA as a group is very interested in everything related to public health, especially for youth. Thank you as introduce yourself. Please put where you're from, the country you're joining in from, and your organization you're affiliated with. While we're doing that, while we're introducing ourselves, my co-host Jemba is going to introduce the executives, because PHIGA has some executives, and PHIGA also has some volunteers. And today we're going to be inducting the members, which are you guys, and we're happy that you're here. So while you're doing that, Jemba is introducing us to the executives, so you know the wonderful people that have tried to make PHIGA run up until now. So Jemba, you can go on. Thank you.
Thank you very much, Yowande. And yeah, I'm very excited to see people from all over Africa join in and stand together for the same cause. So I'm going to just take us through the executives of PHIGA, and PHIGA stands for Public Health Interest Group Africa. Yeah, we are a diverse group from different countries, and as as you will notice in the chat, several of our members are from different countries. So our president is Mr. David Adetula. He's a trainee dentist in Nigeria. And then we have Miss Eunice Omoni, who is our vice president. She's also very passionate about public health and youth empowerment, and she's done several things in the same field. I serve as the general secretary. I'm from Uganda. I'm a final year medical student here at Kampala International University. And my assistant is Mr. Abdul Basit Fasasi. He's from Nigeria, and he's also very passionate about the public health field, and also good at youth empowerment. So moving on, the head of communications here at PHIGA is Mr. Olumide Noah. He's responsible for all the design that you're going to see in the coming days, and the things that you've seen before, the social media platforms that you've noticed. It's Mr. Olumide Noah who runs everything here. Then we have the financial controller. Our financial controller is Miss Darasimi Adeleke. Yes, she's our financial controller. Anything that runs with the finances, it's Miss Daramisi Adeleke. Then our research lead is Mr. Abdul Hamid Babatunde. Mr. Abdul Hamid Babatunde is the lead of research, the research department here at the Public Health Interest Group Africa. And we've already started up a number of things with the research training. And as you will come to realize as we go ahead, that we love to venture into research and then find out solutions that we can do to better the health of Africa. Then our project lead, the man who is in charge of the projects that we run as the Public Health Interest Group Africa, is Mr. Praise Oknolola. Sorry about that. Yeah, he's the man that runs all the projects here at PHIGA. Mr. Daniel Ajayi is the assistant research lead. So he helps Mr. Abdul Hamid Babatunde, and they work together hand in hand to make sure that we come up with researches that are relevant and also sustainable in bringing about a better and healthier Africa. Miss Nosifo Dalamini, she's from South Africa, and she happens to be our human resource manager. I believe most of you have interacted with Miss Nosifo on a number of calls, especially the members. You've interacted with her, and there's a high chance that you've received an email from her one of these days. Yeah. Then my co-host, Miss Yewande Ogunkwande. I'm sorry if I pronounced it wrong. Yeah, she runs. She's the assistant human resource manager here at PHIGA. So generally, that's the executive. We're a team of 11 people here, and we are very happy. We are very happy to see you guys joining in and committing yourselves to bring out a healthy Africa. And just know it's the youth that have the lead in doing this. So you realize we are the biggest percentage right now in globally. So it's upon us to come together and create the change that we want to see. So with no further ado, I would like to welcome David to tell us about PHIGA, the history of PHIGA. What is our vision? What do we plan to do as PHIGA? David, remember, David Adetula is the president of PHIGA, the Public Health Interest Group Africa. So, David, if you could unmute and open your video, it would be really nice to hear from you right now.
Okay, I was on mute. Hi, everyone. Can you confirm if I'm audible, please?
You are audible, David.
All right. Thank you very much, Jemba and Yewande. It's a lovely time. And then I'm really excited to be part of this wonderful event. It's a very huge privilege to be doing this, talking to every one of us. And then I really would like to appreciate you all taking out time to join the call. And maybe it isn't too early to also tell everyone congratulations for making it into PHIGA. I'm very sure later on the call, we have details concerning, the statistics of those who registered to join PHIGA and those of you eventually got in. So once again, make yourself very comfortable. I'm very sure, our guest speaker, any moment from now, should join the call, and then we'll get right into, the conversation. But right before then, I'd like to tell us quite some things about PHIGA. I know many of you would have been, seeing PHIGA. Oh, it looks great, on social media and everything, but you really don't have a good grasp of what exactly PHIGA entails. So that is why I'm just going to be taking us through that in a short while. So it's a very short presentation, anyways. So how far we've come and what is next for us. So here I'll be talking about sort of brief history of PHIGA, then a mission and vision, and some of the activities we are doing, and of course, I would officially launch PHIGA. So I'll get right into it. So please, next slide. All right, thank you very much. So basically, what is exactly our motivation to start PHIGA? So I know some of you probably have been following us on our social media channels. We shared some days ago the details of the co-founders, their profiles, and of course, we have about 5 people who actually came together and said, "Oh, look, we need to solve some problems on the African continent, and of course, in our own way." So, and what were the things we saw? Like you all know, or you may know, Africa has a population of about 1.2 billion people, right? And there's an estimation that by 2050, the population of Africa would double. So we're looking at about 2.5 billion people, in Africa, the African continent, by 2050. And what that tells us is that we're going to grow really fast. And United Nations, mentions that the growth rate for Africa is really awesome. I mean, it's just out of the norm. For us, we're going to experience a growth rate at about 2.7%, and this is more than 2 times what continents like South Asia and Latin America would experience. From our statistics, South Asia would experience growth, but at the rate of 1.2%. Latin America is even having their growth rate at less than 1%. So that tells us that we have going to have like human resources advantage in quotes. So on the African continent, Nigeria is projected to actually have about 400 million people by 2050. That is also about a double of what we have at the time. Currently, Nigeria has a population of about 200 million, right? So, and of course, this would mean that we're going to be overtaking the United States as the third most populous country, in the world. And of course, that would just be only after China and India. So, this kinds of gives us this clue as to what the African continent will be by 2050. That's just about, about some 30 years from now. So, and interestingly, and what I would call an advantage for us here on the African continent is the fact that 60% of the African population are young people below the age of 40 years. I would just want to paint a picture, compared to a continent like Europe, where the population of some of the countries there are, is a very aging population. But for us in Africa, we have an advantage of we're going to be having young people. 60% of our population will be young people. And what that comes with is that we have an advantage in terms of the strength. We have an advantage in terms of the intellectual, strength. Yeah, if I may put that way, to carry on and carry out some things. So I'm saying that for us now, as PHIGA, where we thought to come in is that these human resources, as it were, I mean the young population, how do we translate these human resources to production, and we translate to a productive how am I going to put that now, like how do we translate that human resources to development? Yes, literally development. So, and one way we saw is to ensure that and one of the things we identified as co-founders then was the fact that why don't we try to key into a vision that would, you know, ensure that this population by 2050 is a healthier population. So, of course, we understand the burden of diseases on our continent at the time. We understand there's a lot of issues on our continent, but we want to come in and try to prepare Africa in a way that we're able to meet up, we're able to translate that human resources, that huge number, to development. I already mentioned earlier that 60% of the population will be young people. Then, there's no point having that population, but that population is sick, or having that population is not healthy enough. The population is not productive. Let's say mentally, the mental health of the population is not optimum. So there's no way we can actually make the most of that population. So this is where we are coming in as PHIGA. So like we know, when we talk about the Human Development Index, there are certain parameters that are considered. And one of the parameters here is the life expectancy, right, of the citizens. This is where we hope to come in. This is what we hope to improve. Currently, the life expectancy of the average life expectancy in Africa is just about 55.4%. I mean, 4 years rather. So that is very low. So imagine if we have a population that has most of young people, and by the age of 55, they are no longer functional, or they're no longer productive, so to say. And that's a huge concern. These are the things we have identified, and we hope to, to resolve. And of course, in resolving this, now we believe that it's not going to be a duty of just about 5 people or some 100 people. We thought that, oh, we need to bring in those who have similar interests, right? Those who are able to join us in this journey, those who are able to work with us to achieve this goal. So that's basically how PHIGA came to existence. Yohan, please, could you take it to the next slide, please? Thank you very much. So of course, we started PHIGA, and at this point, I'll just say that PHIGA, that's the Public Health Interest Group Africa, is a coalition of tertiary institution students and young professionals with an interest in the public health of the African continent. I want us to take note that we're not just saying medical students, right? Because we understand. I mean, I don't want to jump the gun because I know the HR has details and they're going to give it to us. But I know that PHIGA is a very diverse group. We have medical students, medical doctors, we have nurses, we have pharmacists, we have engineers, we have a lot of professionals, right, working together with us to ensure that we achieve our vision. So I'm saying that isn't just students. I mean, PHIGA isn't just comprising students alone, but we have young professionals, in fact, mid-career professionals, yes, amongst us. We have lecturers, we have academic staff, we have a lot of great people. And of course, on this call, as you are members and volunteers and all of that. So so that's basically it. So how do we envisage that we're going to achieve some of the things we hope to achieve? So our mission is to steer the interests of African students, right, and early career professionals towards public health. And we're going to be doing this via engagement, enlightenment, career development amongst our members, right, and of course amongst our members first before we go to the public. So our vision basically is to build a coalition of students. Like I mentioned earlier, what we are trying to achieve is want to build a coalition of students and early career professionals who are well equipped to deliver Africa that is healthier. Remember, I told us we already identified those problems. So ours is to build that continental organization that is able to offer this platform for people with similar interests to rescue Africa and to ensure that our human resource advantage turns, to development ultimately. Next slide, please. Thank you. So I already mentioned about five people came together, about five of us came together, and that was in July 2022. That was last year. That's barely about some less than a year, anyways. So, and of course, after that, we thought that, oh, just five people definitely cannot run this deal. So we had to, request that, we had to bring on board executive members in different capacities. I'm very sure right before this time, Jemba already introduced some of the executives. Virtually all the executives actually to us. So we have we opened the application again for those who have been following us on social media platforms. You would have seen the call for volunteers and call for executives. So we had our executives come on board, and then uh, they resumed duty on the first day of December 2022. And from there, we also had our volunteers. Volunteers were recruited, about 40 to 50 volunteers. I know there was a time we did some downsizing because those who were not active and all of that. But we initially brought on board about 50 volunteers, and of course, I believe we have about 40 of them who are still very active. And some of the things you've been seeing around that you see on our social media, all those activities we do, they're not just done by they're not just done by our executives alone, they are done by volunteers too. So we had at some point in time last year, that was in December 20, if I'm correct. So we partnered with an initiative in Uganda to carry out medical outreach, and of course these things were done. These engagements, these activities are being done. PHIGA activities are being carried out by volunteers. Basically, that's what I'm trying to say. So, and of course, um, uh, very soon when you come on board, you would definitely see a call for those who are interested in joining us as a volunteer. This opportunity will only be open to members, anyways. So, next slide, please. All right. So, what do we have to offer our members? What are we doing? So, of course, like I mentioned earlier, ours is to create that platform for those who are interested in public health to come together, to cross-pollinate ideas, right? To network, to collaborate on projects. And of course, some of the things we'll be doing include outreaches, like I mentioned. We'll have trainings, we have advocacies on different health issues, on every different health issues. Of course, like I mentioned also, we have volunteers. And of course, opportunities, we share opportunities with our members, with our volunteers, opportunities to attend programs, opportunities to take on projects and all of that. And also a bulk of the things we also hope to achieve is research. We'll be having research across different subgroups. I'm very sure during the call for members, we asked that you select some pick from some subgroups, right? So once after this call, in the coming weeks, we would break into different subgroups where we would interact with our colleagues. And of course, some of the activities will be happening in those subgroups would include research, carrying out research, original research, reviewing papers and all of those things. And also, one of the plans we also have on board is the mentorship program. We have been in talks with leading public health professionals in the academia, those practicing, some of the leading African public health professionals that have already committed to mentoring young people. So also, we don't want to assume everyone is going to be interested in that. In the coming weeks, we'll also open the call for those who are interested in joining, especially the pilot phase of our mentorship program. So these and many more we're going to be doing. So next slide. I understand way behind time. So thank you very much. That is just like a brief summary of PHIGA. So if you have questions for us, of course, there will still be time for Q&A. But of course, I mean, for question and answer. But if you have questions beyond this call, you could shoot us an email at office@figa.org. So thank you very much, everyone, for taking our time to listen. I'll hand over back to Yewande and Jemba. Thank you.
Thank you so much, David. I don't know if you can you hear me, please? Am I audible?
You are
Yes, you are. You are audible. I can hear you, sir.
Okay, thank you very much. Well, thank you very much,
can hear
David.
you.
That was a very nice introduction to PHIGA, and you giving us the history of PHIGA, how we started, our vision, our mission, and the things we've done so far, and where we are planning to go. So as you can see, we are going somewhere. And to everyone that has signed up as a member, to the volunteers, we thank you very much for joining this call and being passionate towards causing a change in Africa. Now, I'm going to invite Ms. Eunice, our Vice President, to introduce the keynote speaker of the day. And trust me, you want to be on this call for when that happens. Ms. Eunice, please, could you unmute and talk to us?
Thank you, Jemba. Hello, everyone. I trust we are having a wonderful time. So, our guest speaker for today's occasion is Miss Rebecca Cherop. So, kindly follow me as I introduce her to you. Rebecca is a global mental health research champion and a lived experience advisor with over 4 years of experience. She is currently a student of mental health, human rights, and law at the International Center for Mental Health Law and Policy, India. She is actively advocating for increased access to quality mental health care for young people in Uganda and beyond through our non-profit, the Semicolon Nation. Rebecca has worked with a broad range of stakeholders in drafting and promoting policies and research and making recommendations to governments on mental health. She has authored several articles and scientific papers published by global mental health organizations like the Lancet Commission on Global Mental Health and MQ Mental Health Research. She currently serves as a champion under the African Union COVID-19 vaccination Bingwa initiative, sits on the Global Mental Health Peer Network Executive Committee, and is a member at the inaugural Africa Center for Disease Control Youth Advisory Team for Health. Ladies and gentlemen, with your electronic hands, join me as I welcome Miss Rebecca Cherop.
Hello everyone. I hope you can hear me. I'm trying so much to connect my internet so that you're all able to see me. But I'm still working on it, but I think we can go on. First and foremost, I'd like to congratulate you all on the launch of this great organization, and not just an organization, but a movement of young, energetic people, African youth, you know. And so it's a pleasure to meet you all and just to interact and get to know more about the public health interest group. And it's a pleasure to be speaking and also just sharing my thoughts and mainly focusing on how we can achieve the new public health order in Africa. Thank you so much for having me, and I'm excited. And I must say that I'm now part of the Public Health Interest Group Africa, because this is us, this is Africa, and we must represent. Um, so let me. Okay, so I'll just continue. I'm so sorry about my network. Um, so today we are launching the Public Health Interest Group in Africa. And when we say public health, of course, let me assume that we all know what public health is. But mainly, most importantly, what are we doing for our continent? I think that's what matters for me. From my when you read my biography, you realize that I'm in a space of so many things. I'm in mental health, but now also with Africa CDC on the AU Bingwa initiative. And so last year, actually not last year, in 2020, when the pandemic hit the continent, we, okay, can you see me now? Okay. I hope you're able to see me.
Yes, we can see you.
Okay, all right. Let me hope my internet will be just fine as this. So just to delve you into the new public health order. So in 2020, when the pandemic hit, you all realized that of course, we're all affected and mentally and physically. We lost our loved ones, and all that happened. But then when the vaccines came, uh, we weren't given the vaccines that we needed. And so you all saw how countries, out of Africa had vaccines, and then we had to struggle so much to get the vaccines. And so last year at the UN General Assembly, the Africa CDC sat down and they decided to come up with the new public health order to ensure that this does not happen and that we uh, won't suffer again in case of any pandemic. So um, um, okay, hope you can hear me. So when that happened, they came up with 5 pillars, mainly that drew us closer to how we can achieve the new public health order. But before we go that, yes, just to reintroduce myself, I'm Rebecca Cherop. I'm from Uganda, but currently I'm in Namibia. We are currently training 100 young Southern African youth from 9 countries in Southern Africa. And so we're training them, empowering them, and also giving them knowledge on how they can go into their communities and educate people about the pandemic, COVID-19, and also ask them to vaccinate. So that's why my network is not so clear because of that. I hope um, you're able to understand. Yeah, so I serve on the inaugural youth advisory team for health, and we are a team of 5. So I'm Rebecca from Eastern. I represent the Eastern Africa region, which has about 10 countries, and then we have Margaret, who serves on the Southern Africa region. We have Edward from Ghana, who serves on the West Africa, and then we have Rim, who serves on the Northern Africa region. And so this is really new because, yes, we represent Africa CDC, we represent all the African youth. That's why we have all representatives from different countries. And then also we ensure that Africa CDC strategies and initiatives are inclusive of youth. And so we're always sharing what the youth can do and how much and how they can be involved. For example, recently we are currently having the pandemic, not the pandemic, the cholera outbreak in Namibia. In Malawi. I'm in Namibia, so in Malawi, and we've had a chance to see how do we involve youth in advocating, in saving people on ground, and educating communities about cholera and all that. And so it is still going on, and we're excited to have young people be part of it. And then we also support Africa CDC to have meaningful and inclusive youth engagement. So last year we had the first youth pre-conference in Rwanda, the very, very first. And through that, after the 2-day pre-conference, we were able to, the director, the current acting director was able to come up with the youth advisory team for health, so that we can have young people in these spaces and see how they can be part of all the initiatives that Africa CDC is doing. So yes, so that's basically what I'm currently doing now. And so let's speak now about the new public health order, which is our main, goals today. And so the new public health order is a roadmap to sustainable health outcomes, and health security in Africa. And so, like I explained before, this happened. It was, when the pandemic happened, it was like an eye opener of how our health systems are bad, honestly, of how Africa is not a priority when it comes to the global health strategies and everything. We are not on the map. And you also have vaccines, the vaccine inequalities happened. And it was quite tough, yeah, because vaccines came almost a year after the other countries had received. And so our African leaders sat down and they thought about how best do we solve this, so that next time when a pandemic happens, we are not able to struggle, we are not able to suffer. And so they sat down and they came up with 5 pillars on how we can achieve the new public health order. And so the 5 pillars mainly stand on: one, the strong African, ensuring that we have strong African, mark the word African, public health institutions that represent African priorities in global health governance that drive progress on key health indicators. And personally, I think like this is where we all fall. I think this is where we all fall under PHIGA, because I believe that this is a strong public health institution that has young people, and we are representing African priorities. Africa is our priority. So it's really great to see you guys coming together and putting this in order. It's a very great step, and I'm proud to be a member officially. Then secondly, amongst the 5 pillars, the second one is expanding manufacturing of vaccines. And so currently we're establishing, as Africa CDC, they're establishing vaccine centers in South Africa, Egypt, and Kenya and Rwanda. Those are the main. And so we have all these vaccine manufacturing industries that are coming up to solve, just in case a pandemic happened, we will have our own made vaccines, and I think that's really great because we won't be able to depend on the outside countries abroad. We have to wait for them. So I think this will really be great in achieving the public health order. And then thirdly, investing in the health workforce and leadership programs to ensure Africa has the workforce it needs to address health threats. And today I was just thinking about it and I realized that we have so many young people. When you look at how many health workers we really have less, yeah. And it's a big struggle because we're trying to come up with all these orders, but then the workforce is not there, and we don't even have those that are there don't have the opportunities, they don't have the right, for example, there are no medicines in hospitals, the health systems are still weak, and so the health workforce needs to be really strengthened. And so that was one of the pillars that was thought about and put on paper, and actually they're working on it. And so we currently have Africa CDC launched 2 fellowships. So we have the Kofi Annan Fellowship that's happening in just building the workforce and giving young people leadership skills on how they can be leaders and ensure that Africa, that we address the health threats, and then also looking at the health. When we look at how Africa CDC has been able recently, just a month ago, they launched a ministerial program for all African health ministers. And so this is a fellowship that will be running through the year. And so just to empower and give them knowledge, and most of African countries have ministerial leaders, health ministers who are not actually doctors, they're not public health people. And so this also affects on the delivery of work. And so Africa CDC sat down and thought about how they can best achieve this. And so they thought of, to empower these ministers, they need to go through a training of a sort that has been designed to empower them and teach them more about public health and how they can work. And so that is kicking off this month, and we are very proud of it to see that that these leaders are being taught and trained. And so youth, for us to achieve the new public health order, youth are at the forefront. We need to be at the forefront of every program. And so as Africa CDC, just to make sure that youth are at the forefront, we came up with uh, there's an initiative called the Africa Union COVID-19 Bingwa Initiative. And so this aims at amplifying youth voices on COVID-19 vaccinations Africa, and that is what we are currently doing. We're currently training 100 young youths in Southern Africa, just empowering them and giving them skills to go to the communities and advocate for vaccinations, which is really important. We make up over 65% of the population in Africa. Can you imagine? Under the age of 25. And so these are strong young people that are coming up, and we need to find a way of training them and building them and giving them all the skills so that they're able to go to the communities and empower other young people, right? So we make sure that they are active vaccine advocates. They're educating and disseminating COVID-19 information. And the most, what I'm so excited to announce is the Bingwa initiative is growing. It's no longer focused on COVID-19 alone, but now we're thinking of ways of how we can bring in other diseases. For example, there's TB. We've focused so much on COVID-19, and we've forgotten that, people have to vaccinate, against polio, people have to get treatments and all that. And so there are other disease outbreaks. There's cholera right now, there's Marburg in Tanzania. There's a lot happening in our continent. And so we need young people who are going to speak, who are going to educate communities about these diseases and how they can prevent and protect themselves. And so the AU Bingwa initiative is just one of the things that we're doing to involve the youth. And then we have the Youth Advisory Team for Health, where I sit. That's also one of the ways what Africa CDC is actually doing to ensure that the youth are on board. And then the annual, it's now annual. Last year was the first time, but this year it's also happening. So you guys look forward to it on how you can get involved with it. We have the Youth Pre-Conference happening in Zambia in November this year, and we'll be convening around 500 young people for the conference. And so, and young public health enthusiasts, let me say that just to be in line, yeah? Yes, so it will be really great to see you, some of you guys, part of it. You can reach out to me and we see how you can be part of that. So those are the different ways that Africa CDC is doing to ensure that young people are involved, having meaningful engagements in being part of the different initiatives that they're doing. And it's a pleasure that I am on the team. So next slide, please. Okay, yes. So the roles of youth in achieving the new public health order. We are all young people here. Is there anyone above 50? Jemba, you're laughing. We're all young, and we're all young. We're all below 50, right? And it's very, like I said, we have the youngest youthful population in the world, and so we can't just sit and do nothing about our health systems. We have a lot that we can do, and so to achieve the new public health order, based on the 5 pillars that I earlier on mentioned, we need to be um, community change agents. And so this is through joining the AU Bingwa initiative. Um, you can join the PHIJ, which we are all now members. And then also there's ALMA, the malaria, uh, focused on eradicating malaria in Africa. And then we have the AMREF Y Act. You can join all these platforms. They're really volunteering platforms, but it gives you the opportunity to go on ground and do something for the continent, which is really, really important. And also, we need to and through that we are actually agents of change, because if you have the opportunity to, for example, volunteer, and you're in you're in the deep villages of Nigeria, you have the opportunity to go to communities and talk to people about the different diseases that you're focused on, to talk about public health. So it's really great that we young people can be part of all these initiatives that are coming up and use our voices to make a change in our continent. And then the second that I thought about was high level engagements. And so we have intergenerational dialogues to bridge the gaps between the different generations. The old, we have so many, our presidents, our health ministers. You look at our CEOs, they're also old. And so there's this whole age difference gap. And I think we need to have intergenerational dialogues to ensure that we spur conversations and have support and engagement so that they understand our point of view, because the things that they're doing are the things that affect us as young people. And the fact that we're the upcoming leaders in the health sector, we need to speak and see ways of how we can engage with these people. And so one of the ways that I earlier mentioned on was the youth pre-conference. It brings together youth across Africa, where we have conversations and panel sessions. We have different sessions going on just between the older generation and the younger generation, understanding what exactly is affecting the youth, how do we involve the youth, what do we need to do on ground to ensure that other young people join us. And that's really important. And then we need to fill the human resource gap. The future of African healthcare depends on innovation and human capital resources, and it clearly depends on the young population. The fact that we are 65% of the population, of Africa's population, then we really have something to offer, right? We'll have something to offer. Everyone has something to offer. Our stories are powerful, our experiences, our knowledge, our skills. And so through meaningful youth engagement, this is an opportunity for us to spur and enhance the workforce capacity. This is through volunteering, through building skills. We all have internet, we have access to internet. Use your internet well. What are you, for example, what are you studying this month? There are so many online courses free of charge that you can do to just build your skill, which is really, really important. And so we need to move from back end support systems to forward end leadership roles. I'm very excited that we are launching this organization today, just as a platform for young people to actually share their views and have a place to speak up and use their voices. And so if the future of healthcare in Africa depends on innovation and human capital resources, then it really depends on us, because we have all these things that our leaders don't have. Look at internet, look at the education and everything. We all have that. And so Africa charges.
Miss Cherop, we kind of lost you there. I think she's having issues with her network. Miss Cherop, can you hear us? I think she's finding difficulties with her network. We will wait for a minute and then have we. Yewande, could you please help me confirm if we still have Miss Cherop on the call? Otherwise, I hope we've been picking a lot from what she's been sharing, and she has put up a number of key things. And to my some of the things that I've noticed personally, she has given us an outlook of how the health care sector in Africa looks like. And she has mentioned and showed us some of the key areas that are lacking and the things that are being done to counter whatever is happening. And she went on to show us our role as the youth in engaging into the new public health order and where we can come in, the opportunities that are available. And this is all to show us that even through PHIGA, this is it's a platform where we can actually come to bring into life the things that have been debated about, the things that have been put in the new public health order. It's a platform for young people, and it's our time as the young people to come up and then create the change, like I mentioned earlier, the change that we need. So, Yewande, did we still have her on the call?
I've actually
I
connected
don't
using
think
my
so.
phone. Yeah.
Oh, perfect. Perfect. We lost you while you were talking about the conclusion. Could you please maybe start there, if that's okay?
Okay. I'll just put on the slide.
Okay. Can you hear me?
Yewande is going to put up the slide.
Okay.
Yes, we can hear you very well.
Yes. So you lost me when I was concluding. Yeah, what I was just trying to say is that we all have a role to play. Our experiences, our skills, our voices have power to change the system. And so we all have something to offer the continent. And so we need to be joined, all these spaces that are being created, join, just join, apply, join, use your voice. You don't even have to be attached to an organization to actually change, make a difference in your community. And I think that's what turns out for me. And that's what has always stood out for me, because besides the youth advisory team for health, I'm into mental health advocacy, and I started out of nothing, and so you don't have to have all these things to attach to you. You just need to wake up in the morning and make the decision and make the choice to actually make a change. And we all need each other. And so to achieve the new public health order, yes, the youth have to be at the forefront, as I said. And so that's why all these places, the conferences, the initiative, the Bingwa initiative, the youth advisory team for health, all that Africa CDC is trying to do is mainly focused on engaging youth. And so we are growing, like I said, the Bingwa initiative is growing, drawing off from COVID-19 to other diseases. Yes, so we must act, and we must act right now. Yep.
Wow. Thank you very much, Miss Rebecca Cherop. I'm very motivated. I'm very motivated with everything you've shared from throughout the presentation. I was telling the entire team earlier of how you've showed us the need and the things that you've given us an outlook of how the healthy care system of Africa is, and shown us the loopholes. But then you've given us an insight on where we can come in as the youth, the opportunities that are available. And I think that's very key to most of us to realize that you can start, and you're a testament to this, that if you're passionate about something, go for it, and you definitely cause the change that you envision. And thank you very much. We are very happy. So I want to at least put up an opportunity, if that's okay with Miss Rebecca, to get at least 3 questions. Yeah, at least 3 questions in the chat. You can put the questions in the chat, and either one of us from PHIGA or Miss Rebecca, we can respond to those questions. 3 questions strictly. If you can do that and put it in the chat right now, it will be very good. Yeah. So I'm going to check my chat right now. Yeah, Ms. Yewanda has taught us to put up the questions in there. So if you have any questions that you would like to direct to Miss Rebecca, to David earlier on, well, actually, we are going to have another question and answer session later. So I think we could keep these ones just directed to Miss Rebecca. 3 of them, the first 3 questions that will come up are the ones that we will have Miss Cherop come and answer. We are waiting. Should I assume you're all satisfied, like I am, with the presentation that Miss Rebecca put up earlier? Oh, Niga Doreen, she has a question. Please, you can put it in the chat. Okay, there is one from Mr. Safari Junior Julius. He says, Safari Junior Julius, thank you, presenters. How possible is it to obtain links to ALMA and other platforms mentioned by our beautiful presenter? Maybe shared links. Thank you. So can we have Miss Cherop, do you think it's okay to first answer this? Then we'll have you come in after, again, for another question rather. Do we still have Miss Rebecca on the call? I wonder if you could help me. Do we still have Miss Cherop on the call?
Yeah, she is.
Okay. I don't know if you can hear me.
I can now hear
okay,
you.
thank you.
Sorry about that.
Yes. So yeah, the question was, it's from Mr. Safari Junior Julius. Please, the other people, could you please also indicate the country you're in or you're asking from? It would be really nice. So he wanted to know, sorry, I kind of lost that. Let me get it back. So he was inquiring, how is it possible to obtain links to ALMA and the other platforms that you mentioned earlier, and maybe shared links? If thank you. So could you please respond to that?
Oh, yes. Sorry about my network. Yes, you can be part of it. You can check through the websites. Look at you can read about the Bingwa initiative that's really growing, and also I mentioned Alma, though I'm not part of it, but I know about it. You can also go online and check about it. Just read about all these initiatives that are coming up. So maybe I'll share the links with David, and then he'll share with you guys, if that's okay.
Yeah, that's totally fine. And
Okay.
maybe also,
Yeah.
I could add something to that. If you follow the PHIGA online, on our online platforms, Twitter, LinkedIn. We will be putting up some of the things. So please just be sure to follow us on our social media platforms. Then the other question is from Ms. Naige Doreen. She asks, what strategies does the youth, the YAT for health, the Youth Advisory Team for Health, have to ensure capacity building of the youth in Africa under the new public health order?
I think so. Like I'm not also part of the Y Act, but I have friends there, and so when you look at Y Act, it's mainly focused on young people. What AMREF is doing and its programs and initiatives, and so it's focused on how young people. It's quite alike like what Africa CDC is trying to do, and so it's bringing. It's mainly focused on training and building young people and giving them the skills necessary for them to go to their community and ensure that they are empowered, mainly focused on health, health advocacy. And so Y Act is really broad. The main goal is looking at the 1.8 billion young people across the world, not just for Africa, really. And so it's really broad. They've grown. It's not something new. And so it's a very good space that you can also join if you're a young person, because they'll give you, they're mainly into capacity building for young people. And so they'll train you, they'll give you the skills, you'll volunteer and work with them. And yes, I would advise that you all look out for them also and join and ensure that you're part of the movement. Yeah.
All right. So I'll take our last question. It's from Mr. Praise Oknolola. He asks, thank you for the presentation. Are there any particular skills or areas of expertise that you think are particularly important for African youth who want to make a difference in public health?
I think for me, the biggest really is advocacy. If you can use your voice and speak about something that is affecting your community, that's important. The skills are, the youth, they come in, the skills that we all need, speaking, all that comes in. But I think for me, it's the choice that you make to make a difference, to use your voice, to use your experiences, to use your story, and to also not just sit when your community is needs change. Yeah. I know Doreen here, and she's doing so many things in Uganda. We both come from Uganda, and so she's in all these places and doing so many things. She's into community advocacy and all that, and it's really great that young people are doing all this. I mean, we're really taking that step to ensure that we make the difference. Our leaders cannot go to the ground. They can't do the things that we want to see in our communities, in our countries. We want to see our countries grow. We want to be better people. We want to see the health systems growing. And it's great that we are taking that step. We are formulating all these initiatives and organizations just to make a difference. And I think for me, that's really important. That stands out for me. That making the choice to not keep silent when things are bad. So I think that's the biggest for me. And then now through that, you can build yourself, build your skills now, the real skills, just to ensure that you achieve your objectives and your vision. I think that's really important. So for me, yes, that stands for me. Yeah.
Okay, thank you very much. So I'm thinking we can take in another question. There is one question still from Mr. Praise that I think we shouldn't leave out. So he says, you mentioned about the Southern African Bingwa. Is there one for Western Africa?
I beg your pardon?
So he's trying to consult if there is a Bingwa, an African Union Bingwa initiative for Western Africa.
Oh yes, there is. We are coming. We actually rolled out applications. That was, I think, a month ago, if I'm not wrong, and they've been selected, and so we'll be there. There'll be trainings for them this month. This is April, yes. And so from Southern Africa, there's training planned for Western Africa. And so we selected 100 young people to represent Bingwa initiative. And so look out for that too. And we'll be glad to be in West Africa and empower young people that side. Yes. But also,
All
most
right.
importantly, like I
Thank you
said,
very
it's
much.
not only focused
Yeah.
on, like I said, it's growing, and so we're moving. We're right now it's focused on COVID-19, but in the near future, it's going into different diseases and how we can advocate for all that. So yes, there is Bingwa Initiative Western Africa coming up very soon.
Yay. Thank you very much, Miss Cherop. I mean, this is very interesting, and thank you for giving us insight on a number of issues and showing us that we can actually do it, and being a motivation to very many young people. We are very happy as the Public Health Interest Group Africa to have you, particularly to be on this call, and it means a lot to us. So we're going to move on to the next thing on the agenda. I'll ask my co-host to come in right now and take on.
Thank you,
Thank you.
thank you, Ms. Cherop. It was a very,
Thank you
very
too.
informative presentation, and I'm sure we've learned a lot. Some people might still have questions. You can still drop it on, and would reach out to Ms. Cherop if she can answer some, and would reach out to the membership group or the volunteers group. So going forward, we're going now into the induction of members. And like I said, this is the official PHIGA launch, the meeting webinar, which we just had, and the induction of the members. Okay, so, and to do that, we're going to have like a summary of the membership drive or the membership application process, and this will be chaired by the Human Resource Manager, Ms. Nosifo Diamini. Nosifo, if you're here, please, can you just let us know?
Hi, Yawande. Yes, I'm here.
Okay, thank you. All right, so Nosifo is going to just take us through what the membership drive was, how people applied, and the people that were selected to be members, and then we'll go delve into the induction of the members. Nosifo, you can take it on.
Thank you. Thank you so much, Yawande. Good day, everybody. I am so excited to be here, and thank you for joining the launch. We are very, very, very excited to have you, each and every one of you. So my name is Nosifo Lamini. I am joining from South Africa, and I just like to firstly apologize for the unprofessional background that you might see. I am at a funeral, so I have to sort of like split myself two ways, to be at the launch and to also be at a funeral. So I really apologize for that. So let's start by speaking about the number of applicants that we had for the membership drive. So we had an overwhelming number of applicants, which was 704 members. And it was really a challenge, and it was really exciting, and it was heartwarming to see so many people actually having the interest of joining this type of initiative. So from the 704 applications, we selected 500 members from the different professions that you will see on the screen presented in front of you. So those were the different professions and the areas of interest that our applicants had interest in. If you can kindly move to the next slide, please, here one day. So that's just an addition on what I have spoken about now. So the different type of professions and areas of interest. So in terms of, or to add on to that, we had we had applications from 23 countries. So that was really amazing. And so because we received a large number of applications from Nigeria, we had to ensure equity and proper representation. So every application that came from outside of Nigeria was accepted. So yeah, we're currently sitting with 500 members, and it's really exciting because it was our first drive for recruiting members to join PHIGA, and to have such a huge number was it was quite a success for us. So we're really, really excited to have you guys, and thank you for joining the call. So to add on, just to give you more about the benefits of being a member of PHIGA. First of all, it's absolutely free. You don't have to pay any joining fee. So that's the first benefit. And furthermore, you're eligible to attend our webinars, our seminars and workshops. And you also have access to our resources like our magazines, our newsletters, and any opportunities that might arise during the year. And another one is that you'll also be able to join our outreach programs when we are having outreach programs. So you will have the facility to join those programs, and you will be prioritized when we're recruiting for volunteers. In the coming weeks, you will be prioritized to become one of our volunteers if you are actually a member. So those are some of the benefits, and also you can get a certificate of membership. So that would be good for your development, your professional development as well. So that's just some of the benefits. And lastly, I just want to please kindly encourage you to please be very, very proactive, be participate when we have meetings, when we have outreach, when we have those type of programs in our webinars. We'd like to encourage you to please join in. And lastly, just to let you know, I think there was a question in the chat box from Adedolapo, who was asking about the volunteers. How do you become a volunteer of PHIGA? So if you can just look on our social media platforms in the coming weeks, we are going to be having a recruitment drive for volunteers. So please look out and please share with your friends so that your friends can share with their friends and their friends can share with their friends. And yes, so that is it from me. I thank you once again for joining the launch. If there's any further questions with regards to what I've just spoken about now, please just drop it on the chat box and I will be happy to respond. Thank you.
Thank you so much, Nasifo. Okay, so now Nasifo has given us all like insights into how the membership application process went. And I'm sure she has answered a lot of questions regarding membership and also regarding volunteering. So we're just going to do like a quick induction, and all just going to be inviting again Miss Rebecca Cherop to just do a quick induction of the members into PHIGA. Miss Rebecca, are you here? Miss Rebecca, can you hear us, please?
I think she's probably having a network issue.
Yeah. Okay. While we just wait for her to join in,
I'm thinking maybe as we wait, we could take more questions from the people
yeah.
to let us know anything maybe, and if that's okay.
Okay, so there's a question in the chat box from Perpetual. What's the difference between a member and a volunteer? Nasifu, are you online? Would you like to answer this question, please? Or David, would you like to just please answer this question? Because Nasifu already told us. Yeah.
Okay. All right. Sorry about that. Thank you very much for that question. So basically, there are levels to participation in PHIGA, right? I mentioned we have executive members, right? And we have volunteers, and we have members. So members are basically those who are going to be part of PHIGA as members. So, and Nusif already mentioned some of the benefits that come with being a member. But we consider our volunteers as sort of if I may put, let me say staff in quotes, right? So our volunteers are not paid. Even executive members are not paid. So, but then, as volunteers, you have the opportunity to help us shape the direction in which PHIGA goes. You are part of the internal system. You help us decide what decision needs to be taken at every point in time. So some of the graphics files, for instance, in the social media department, some of the graphics files have been seen around, they were produced and done by volunteers. Of course, there are a lot of other things that we do in our data IT departments now. We have volunteers who are working on our websites, working on on our data analysis, research, volunteers in the research department. We have several departments anyways. So of course, we will share some of these more details with you in the email in the coming weeks. I hope I've been able to answer that question. Yes. Thank you.
Thank you so much, David. I hope, Perpetual, I hope you has been able to answer your question. And if there's any more question in the chat box, I can see that Ms. Nasifo is already answering a lot of the questions in the chat box. But if there's any more you need to ask about PHIGA, about being a member, being a volunteer, please do also drop the message on the chat box. Okay, so someone just asked if PHIGA has a WhatsApp group chat. So PHIGA does have a WhatsApp group chat, but right now it's restricted to the executives and the volunteers. But in the coming weeks, we're going to send emails on how the groupings for the members would be, because it's a different thing. But right now we have for the volunteers and the executives, because we wanted to induct the members in before we go forward into the group chat. So you expect to get a mail from us regarding that in the nearest days or weeks. Thank you.
Is Miss Rebecca now? I don't know if she can hear us. Miss Rebecca, can you hear us right now?
Can you hear me?
Yes, we
Sorry
can hear you. So, Yewande, please, and then you will invite Miss Rebecca again.
Okay. All right, Miss Rebecca. So we're just inviting you for the official induction of the members, for you to moderate the induction of the members, please. Thank you.
Oh, okay. Thank you very much for the order. And just before I do that, I'd like to encourage you guys to continue pushing, continue using your workers, continue doing whatever you can to to ensure that the African youth race is hard. Yeah, and so please keep pushing. It's not easy. It's really tough. It's really really tough, but we also have to toughen up. And uh, to achieve your goals, you have to toughen up to achieve your vision for whatever you're trying to do. And so just keep going, keep pushing. Uh, seize all the opportunities that you have, utilize every opportunity. If it's mentorship that you're looking for, please reach out to the person that you want to mentor you. Learn something, be humble, be humble, guys. And lastly, this is something very, very, just like to urge you guys to focus more on building your skills and not mainly focusing more on how much you're achieving or how much you're getting out of the opportunity. And so focus more on building your skills. We are young people, we are still growing, and it's very important that you build your skills because you need them one day, you need them in doing this. And so I congratulate you all and I wish you all the best. From a proud, PHIGA member myself, I congratulate you all and I wish you all the best. And I pronounce you as the Public Health Research Group Africa members for the year 2023 to 2024. And yes, congratulations.
Thank you.
You're welcome.
Thank you very much. Thank you.
You're most welcome. Please don't hesitate to reach out in case you need information or help or anything. I'm available on social media and everywhere. Thank you.
Thank you so much, Miss Cherop. And so officially welcome to FIGA as member. Thank you, thank you. You guys are welcome, and we're happy. We know that as members of FIGA, we're going to do so much good things in the FIGA space. And so, because most of the guys here have not really been talking, obviously we don't have that space. But just going to do a quick breakout room session. It's just for like you to just interact with a few people in your group, just say from what you hope to get from FIGA or just interact with them. That's just what the breakout session is going to be. So I'm just going to shuffle us into groups. Just interact, know yourselves, know your names. That's FIGA is all about networking, interacting, and that is what we're going to be doing on that group. Okay, so I'm just going to shuffle us into the groups now. Just for 10 minutes, just for 10 minutes, and we're done. Okay. I don't know if there's anyone here who is not in the group. So we're doing a breakout room session. Please just kindly join. If you're not in the group, just you can voice out and then I add it to one. But everyone here
Yes,
is assigned.
yes, thank you very much. I'm actually not in the group. The one I joined, I happen to be the only one there. So,
Okay. So okay, I'm just gonna assign you to that group.
thank you.
You're welcome. So you're assigned to breakout. That's Jonas, yeah?
Yes, yes.
Can you try joining your group again?
All right.
So is there anyone here who is not in a group? Because everyone is assigned to a group. So all you need, even if it's just one or two people, yes, please.
Hello?
Yeah, even if it's just one or two
Hello?
people in the group, it's just for you to interact. It might be just that one person you're talking to. As long as you're not the only one in the group, just let me know. Okay, Lillian, you were saying something, please. So for those just joining in, we are in a breakout session and people are in different groups. So you can just join in your group because everyone's already assigned to a group. Just to interact with the people in the groups. Halita, what group were you in before you got locked out? Can you just let me know?
Sorry, I don't know what group I was in before I got locked out.
Oh, okay.
The connection had been bad, so I actually got logged out a while ago, like
Oh,
some minutes ago.
being on the main call is not bad. Being in a group, we can interact.
Oh, it's actually just for interaction.
Yeah, there's not. It's
Oh,
just for people
okay.
to just to have like an interaction and
Okay.
just know people. There's no big deal. It's
Okay.
ending in 1 minute, so I hope you enjoyed the session. If you were in, it's already ending. 55 minutes. Okay, so welcome back, everybody. I hope we're able to have or know about one or two people from our groups. Some other people are still joining in from the groups. All right. Welcome everyone. I hope we're able to learn or know about people in the group. I hope. Oh, it was really a short time. I wish it could have been longer, but we're strict on time in PHIGA, and so we have to go on with that. All right. So if you guys check on the chat box, you'll see that the social media handles of PHIGA has been pasted there, the Twitter handle, the Instagram, Facebook, and LinkedIn. Please do also follow us, like the content, share the content, repost it. And if you follow, you'll see more information about PHIGA. And if you want to ask questions, you can always send us a DM through any of these social media networks. We're very, very happy and would obviously reply you in no time. And also, while we're still waiting as a form of interaction, you guys can put your LinkedIn pages on your LinkedIn links on the chat box for people to join in and follow you and see the amazing things you're doing as public health um enthusiasts in Africa. And also, like I said, do not forget to follow the pages, the social media pages, okay? And if there's any more question, please can you put it on the chat box before we round off the session? So people are already writing, people are already connecting to people they met in their group chats. This is one of the things we're happy about in PHIGA, networking and connecting for a good cause, of course. So you can drop your LinkedIn pages, and while you're dropping these, don't forget to join or follow that of PHIGA. All right, so while we're doing this and in the absence of no question, because I don't think I can see any more questions. If you have, you can drop, but I don't think I can send. Okay, so I've seen a question from Aisha. Do members get an official email for the membership? So if you mean a personal official email, for now, no. Okay, but there's an official email for PHIGA, but members do not get a special official email, at least not for now. Okay. All right. So while we're just dropping that, I'm going to invite Mr. Olumide, the head of communications, to just give us a closing remark, or would I say a closing speech? Mr. Olumide, are you on the call? Oh, yes, Olumide is on the call.
Yes, yes, I am. Thank you, Yewande. You've done a very beautiful job. And thank you, Jemba. So, good day, everyone, excellencies, ladies and gentlemen. As we conclude our ceremony today, allow me to express my sincere appreciation to all of you for your participation and congratulate us for participating and making the PHIGA launch and induction of new members a successful event. Your contributions has made the virtual session highly productive, informative, and interactive as we seek to achieve an Africa with sustainable health outcomes and better health security. Like as my president has said earlier, PHIGA aims to promote and stimulate the interest of African youth and hence their participation in the delivery of quality health care to the nation and beyond. Hearing and learning from our speaker, Ms. Rebecca Cherop, as well as some of the questions our audience put up, that's educated me and I'm sure all of us here on how we can work together to achieve the new public health order and the youths on how we can strengthen Africa's public health institutions. Before ending my closing remark, I would like to convey special thanks to our guest speaker, mentors who have been extremely cooperative in staying with us beyond the time allocated. Finally, my deepest thanks are of course reserved for the executives and volunteers in PHIGA for their priceless contributions and for running a smooth event. Thank you. Thank you all.
Thank you so much, Olumide. That was so nice. It felt like it was already another speech, and I think that's a very good way to end this maiden webinar and PHIGA launch. Welcome everyone, and thank you for being part of this. Thank you for keeping to the housekeeping rules I laid from the beginning. I didn't have to ask anyone to unmute their mics, and that is really, really good. Thank you so much, and we hope to keep connecting as PHIGA and doing good things as public health enthusiasts through the Public Health Interest Group Africa. Thank you.
Thank you, and well done to you guys. Thank you. You did such a wonderful job. Thanks, everyone.
Thank you, everyone.
Thank you. Thank you
Thank
guys
you,
for
everyone.
connecting.
Thank you,
Please,
everyone.
please keep connecting in the chat.
Thank you for having us.